Our client's name is Emma Simpson. She's a 16-year-old girl who is 5'5" and weighs 135 pounds. She's a cross-country runner, and she's trying to make states this year, but she pulled her hip last year, so she's a little out of shape. We designed exercises for her that are to help her get back into shape, and we will gradually increase the reps and the amount of laps she runs so she can get back into her peak fitness. Since Emma's goal is to run a 5K in under 21 minutes, she needs to make sure she's working on both muscle tone and fitness. Although her main goal is to run long distances, she's also going to be running some short sprints to gain endurance. Her workout is geared towards strengthening her hip, her iliopsoas, to ensure no further injury, and as well as her iliopsoas, she will work her quadriceps, hamstrings, and adductor groups by doing lunges and running, among numerous other exercises. Before Emma starts each workout session, she will do a series of dynamic exercises. The purpose of these exercises is to increase blood flow to her muscles and to make sure she is using all the muscle fibers in her body, which otherwise might not be used in some of her exercises. Each exercise should be performed for 10 meters. The exercises will warm up her muscles so they do not tear or pull when she is running or performing her other exercises. And the warm-up will work the quadriceps, hamstrings, gastrocnemius, adductors, gluteus medius, and the triceps brachii.
The first exercise we designed for Emma are lunge matrices with 10-pound dumbbells. This exercise works the quadriceps, gluteus maximus, hamstring groups, as well as many other muscles. This isometric exercise works to stretch the hips and legs, which are important for Emma, so that she doesn't re-injure her hip. Emma will first perform front lunges. Standing in an upright position with dumbbells in either hand, she should step forward with one foot and touch the knee of the other leg to the floor at a 90-degree angle. She will hold for 5 seconds and then come to a standing position and repeat the same movement with the other leg. Next, she will do back lunges. Instead of stepping forward, Emma will step backwards. And finally, she will do side lunges. It is the same movement, but she should step out to the side.
Because Emma had a previous hip injury, leg swings are going to be very important for her to do. She will do forward leg swings, side leg swings, and bent leg swings. Forward leg swings perpendicular to the wall, swinging the leg back and forth, side leg swings facing the wall, and bent leg swings perpendicular to the wall but with a bent leg. This is an isometric exercise, and it is used to increase hip mobility and strength so that the hips aren't pulled during running.
Before Emma runs, she will want to perform planks, which help to strengthen her rectus abdominis, transversus abdominis, and external oblique. Planks are an isometric exercise that works all the muscle fibers. This exercise will help to strengthen her core and help to maintain muscle tone. Emma will perform 3 types of planks. Low planks are done by placing the distal part of your arm or forearm and toes on the ground while holding your body in a flat position, being sure to keep your hips raised. Side planks are done the same as low planks, but by turning your body sideways, so only one arm and leg are touching the ground. High planks are done the same as low planks, but instead of using your forearms, the palms of your hands are on the ground, making sure not to bend your elbows.
Now Emma will go for her run. She will run 5 miles at a 9-minute per mile pace, making sure to run on hills and flat ground to work her whole body and prepare for races. The isotonic exercise of running increases vascular supply to the muscles, which will improve Emma's endurance and help her get back in shape. Running will also burn calories, increase strength, and improve cardiovascular health. It will work the gastrocnemius, rectus femoris, adductors, soleus, among other muscles. After her run, Emma will do strides. These are an isotonic exercise involving short sprints rather than a long, slower run. Strides are important to improve Emma's running form and allow her to get used to running faster. The muscles used are the quads, hamstrings, gluteus medius, and gluteus maximus.
Emma's next exercises will be hip exercises, also known as Myrtle. These are isotonic exercises because the movement is produced. They are meant to increase strength in the lower body, including her hips and legs, to prevent tears and pulls. The first exercise she will do will be a knee circle forward, which is when you rotate your hip in a circle, raising your knee behind you and then bringing it back down. Next, she will do fire hydrants, raising her leg straight up to the side and then back down. Donkey kicks will be kicking her leg back and then lowering it. Lateral raises will kick her leg to the side, tapping your toe to the side of your hand and then returning to the original position. Finally, she will do clams, where she will be laying on her side, lifting her leg up and down first with a bent leg and then a straight leg.
Finally, Emma will complete exercises with a resistance band. First, she will do 30 seconds of ankle circles on each foot, followed by 20 plantar flexion on each foot and 20 standing hip extensions on each leg. These isotonic exercises are focused on strength, which is important so runners like Emma do not get injured with things like shin splints or ankle sprains. They are also important to powerful running, since strengthening the muscles allows Emma to run faster and more efficiently. They will strengthen the tibialis anterior, gastrocnemius, and soleus.
In order to gain strength and improve bone density, Emma will complete deadlifts as part of her workout. Deadlifts are isometric exercises that work the entire body from the trapezius to the gastrocnemius. To perform this exercise, step into the hexagonal-shaped bar and stand with feet shoulder-width apart. With the bar in your hands, bend at the hip and knees while making sure to keep the back flat.
She will do a dynamic cool down and then stretch. The dynamic cool down helps to relax her muscles and lower her heart rate after her exercises, as well as stretching her calves and preventing shin splints and hip injuries, which are both very common for runners. The exercises in the cool down are walking lunges, toe walks or plantar flexion, heel walks or dorsiflexion, low shuffles, and squats. The stretches Emma will complete after the cool down are isometric exercises that are going to stretch her muscles after she runs so she does not get tight. They consist of quad pulls, toe touches, held lunges, figure 4, pigeon pose, and leg drains.